Dear jury, my name is Karavasiloglou, and it is my honor to present to you my work on the net survival of women diagnosed with breast cancers. This project was funded by Swiss Cancer Research, but the funder had no role in the study design, data analysis, or the interpretation of the results. Even though the term breast cancer is used widely, very few people realize that it encapsulates a number of distinct conditions. In this project, I focused on two: breast carcinoma in situ and invasive breast cancer. Breast carcinoma in situ is a group of lesions in the breast with abnormal cell proliferation. Its main difference with invasive breast cancer is that the proliferation remains in the ducts or the lobules of the breast and does not spread to nearby tissues. Breast carcinoma in situ is considered a non-obligatory precursor or risk indicator for invasive breast cancer, and despite its increasing incidence over the past decades, few studies have simultaneously reported the survival outcomes of three populations: women diagnosed with breast carcinoma in situ, women diagnosed with invasive breast cancer, and those who were diagnosed with both. So I set out to do it. As you know, sometimes it can be challenging to report cancer-specific survival outcomes because the cause of death needs to be identified and then correctly classified as cancer or non-cancer specific. And there are actually a number of studies suggesting that the cause of death is frequently misidentified or misclassified. One way to overcome this is to avoid using cause of death altogether by estimating net survival using a relative survival framework. In this project, I used three distinct populations. All of them were women that were living in the canton of Zurich and were diagnosed with cancer for the first time in their lives between 2003 and 2016. The first population was diagnosed with breast carcinoma in situ, the second one with invasive breast cancer, and in the third population, women were diagnosed first with breast carcinoma in situ, and then, during the study period, also with invasive breast cancer. The first thing I set out to do was compare invasive breast cancer tumor characteristics based on whether or not the tumor was preceded by a recorded breast carcinoma in situ. Then, I performed net survival analysis using the non-parametric Pochard-Perman estimator and the life tables for the canton of Zurich. In this project, women were followed from the date of their diagnosis until the date of emigration, date of death, or end of follow-up, which was 5 years after their diagnosis, or the 31st of December 2017, whichever came first. Moving on to the results, invasive breast tumors that were preceded by a reported breast carcinoma in situ were more frequently detected via screening and at an earlier stage, and also had less missing information in tumor-specific variables including estrogen, progesterone, or HER2 receptor status compared to those that were not preceded by a recorded breast carcinoma in situ. When looking at the 5-year net survival outcomes, breast carcinoma in situ patients, here shown with the blue line, had a net survival of 102%, whereas invasive breast cancer patients without the previously recorded breast carcinoma in situ, here shown with the red line, had a net survival of 89%. Women diagnosed first with breast carcinoma in situ and then by an invasive breast cancer had a 5-year net survival of 92%, here shown with a green line. When I looked into these results, stratified by age at diagnosis, breast carcinoma in situ patients diagnosed at an older age had higher net survival compared to those that were diagnosed younger, as we can see in panel A. When looking in patients diagnosed with invasive breast cancer, net survival was slightly higher for those that were diagnosed first with a breast carcinoma in situ and then with invasive breast cancer at an older age, as we can see in panel B, But the opposite was observed among women with invasive breast cancer that was not preceded by a recorded breast carcinoma in situ, as shown in panel C. Moving on to the discussion, the high proportion of stage 1 invasive breast cancers that we saw in our studies is supported by the literature and might be indicative of the more intensive monitoring that these patients received after their diagnosis. Overall, we found very good 5-year net survival outcomes in older populations, with some small variations existing based on age of diagnosis. All of this was consistent with the breast cancer specific estimates reported in the literature. The high survival we saw for breast carcinoma in situ patients is usually attributed to differences between them and the general population that is included in the life tables. Studies suggest that breast carcinoma in situ patients are considered to be healthier and thus have longer life expectancy than the women in the life tables. Interestingly though, a recent study found very little positive lifestyle modification in breast carcinoma in situ patients after their diagnosis, and in fact these women tended to gain weight and had very little difference in fruit, vegetable and alcohol intake compared to their pre-diagnostic habit, suggesting that this healthier perception might not be true. Moving on to the take-home messages from my project, invasive breast tumors that were preceded by a recorded breast carcinoma in situ were detected more frequently by screening and at an earlier stage compared to those that were not. The 5-year net survival of breast carcinoma in situ patients and of patients that were diagnosed with invasive breast tumors, irrespective of whether a breast carcinoma in situ was previously reported, was very high. Thank you so much for your attention.